Okay, so welcome and thanks for having me. And my name is Moira Pena, and I'm an OT working at Bloorview. And I wanted to actually thank you for those of you who completed my study on the POND network, because I was able to graduate because of you, and I now have a master's degree. So thank you so much. So I'm going to talk about feeding challenges and ASD. And I know that we usually talk about kids who are picky eaters, who are not eating enough, but I also want to talk about kids that I'm seeing now who tend to overeat as well. So I have half an hour, and I'm gonna try to get through as much as possible. So I'm just gonna give you a little update on feeding challenges and ASD research, and then I'm gonna give you my 5 top strategies to work on. Okay, so we know from our research that children with ASD do struggle to eat, so they're 5 times more likely to have feeding issues when compared to typically developing peers. So what this says is that really feeding challenges do come with a diagnosis. It's just the way it is. It's nothing that you did or that it was done when the kid was a baby. The kids with autism do present with feeding challenges. And of course, restricting dietary variety is the most frequently reported problem. And also, children with ASD are 2 times more likely to be overweight and 5 times more likely to be obese than typically developing peers. And obesity, of course, becomes more prevalent as the child gets older, because then they have more access and independence over the food. And I wanted to mention, I know there's a group of children or young adults that we give medications to help them manage very challenging behaviors, and the side effects of some of the medication, of course, is weight gain. So I'm not going to be talking about that per se, but the hope is that researchers will continue to work on finding medications that address that side effect. I'm going to talk about kids who are overeating, okay, who are not taking any of the, I believe it's antipsychotic medication, right? Okay. So this is the iceberg. So why do children with ASD experience feeding challenges? And there's many reasons, okay? It could be an organic reason, so it could be like poor dentition. A lot of kids that I see, they have lots of cavities, but they're not telling us that they're in pain, so we don't know, but that affects the way they're chewing. It could be chronic constipation, diarrhea. It could be things like GERD, so having reflux. So there's also muscular issues that kids on the spectrum tend to show. So a lot of the children that I see and the young adults, they have a difficult time recruiting all the muscles of the mouth to perform what we call mature chewing. So when you're actually chewing your food, you need to be able to bring the food from one side of your mouth, use your tongue in what we call lateralization, and move it to the other side, because you want to use your molars to chew. So what we see most of the time are kids who they do what we call munching. They just eat in the middle, they keep the food in the middle, and then they suck it through. So chewing takes a long time, and it's just frustrating because they're not actually getting the most efficient action with their muscles. You can also, if your child has issues around drooling, or if they were not able to suck through a straw or blow by the age of 2, it's likely that there's a muscular issue around feeding. So that's why they're not eating enough. Or it could be that someone who's overeating, they tend to overstuff their mouth. So you see, I call it squirreling, right? Like they squirrel the food up here. And it's in an effort to try and feel the food, because they can't see it. So in an effort to try and feel it, and then they start to overeat. Sensation, so sensory is huge in our population. So you could be oversensitive to the look of the food, the way it's shaped, the way it touches another food. You could be sensitive to the noise that people make when they're eating beside you. You could be sensitive to the texture, so it's too wet, too chewy, to everything. So sensory issues are big here. Or you can also be under-responsive, right, to the feeling of food. And again, You could have food all over your face and you're not feeling it because of your sensory issues. It could be a learning issue. So, the strengths of autism are, of course, a focus on detail, and also an amazing visual memory. So, the kids that I work with, they remember exactly the way that food was last week when I served it. But if there's there's a little bit of a speck of a difference or whatever, then it's no longer the same food, right? Because it looks different. So to a person with autism, even though it's the same food, the minute there's a bit of a difference, it becomes something different to them. And then there could be developmental issues around expressive or receptive language, nutritional status. So you could have kids who are really stuck on high-fat diets. I mean, that's all they eat. So, of course, that leads to weight gain. And then environmental context, right? So here, what I like to say to families is that, you really want to make sure that wherever the child is eating, which is hopefully on a table, you don't want to be too close to the garbage. So, you don't want to be smelling that. You don't want to have too much noise around. You want to be able to control as much as possible your environmental context. And I think it's important that we work towards bringing children to eat at a table, because when you look at your bed and you think, okay, I have to go to sleep, the idea is that we look at a table and you say, I have to eat. And what I find is that a lot of the kids and young adults that I work with, they're always grazing, right? So they're always sort of walking around and just eating here, but they never sit at a table. And that's just the way, life, we just try our best. But if they don't have that context to tell their brains they have to eat, it's going to be very difficult for them to actually learn to manage their feeding clues, okay? So when is it picky eating and when is it problem eating? So we say if you have 20 foods or less, then, so if you count all the foods that they're eating, including candy, if you count less than 20, there's a problem. If when you're offering new foods, you have a big meltdown, you have poor weight gain or weight loss or too much weight gain, choking, gagging, coughing during meals, that tells you there's more going on. There's a muscular issue or an actual swallowing issue. If you avoid all foods in a specific food group, you cannot look at, touch, smell, or hear others chewing. So I have a child that I work with who cannot look at oranges. If there's an orange anywhere, he just melts down. And we don't know what it is. Is it the smell? Is it the look? The point is, there's a real issue with that. So cannot look at it, cannot manage to be in the same room. And food jags frequently. So these are the kids who you can only give them a certain brand of something, right? So if you change the cereal, they will not eat it. If you change the sausage from wherever you bought it, and if you buy it from, so they're stuck on the brand of the food. And if mealtime is just painful, if mealtime is a constant battle, then we know we have a problem. So my 5 top tips that I'm going to talk about. Number 1 is positioning. Number 2, social modeling. 3 is gradual exposure to foods. 4 is keeping your anxiety in check. And 5 is fighting the obesogenic environment. And I tell you, English not being my first language, I do have a fascination with words. And this is one that I sort of found in my research. And I said, it's true. It's, our environment is set for everybody to gain weight. So we're going to think about a few techniques to try and fight that. Right, so number 1, this one's huge. Most of the kids that I see in clinic have what we call poor or low muscle tone, right? So they're very flexible, so they can do all kinds of things with their joints. They can do the splits. They're constantly sitting in the W sitting, right? They W sit because they want more stability, because their core, it's weak. And it's not abnormal. It's not, if you have an abnormal core strength, then you wouldn't be able to walk. But can I get to you at the end? And then I'll answer some questions. So So a lot of these kids, they tend to lean onto things. They lean on the table. They're lying on the table. They're lying on the floor. They can't stay upright. So what we tend to do is we put them on a chair, and their feet are dangling. And so what happens is that the kid is spending so much time trying to fix their posture that they're never going to eat. Okay? So what we want to do is this. You need to have a footstool. You have to have your feet on the floor for you to be able to manage your core, to bring up your core. And we put boosters like wedges. We use towels. We roll up towels, pool noodles, like anything that makes the space snuggle, where you actually are supporting the posture of the child. Then that will help them for them to be able to then open their mouth and actually eat and not think about how am I going to stay on this chair, because I can't. Okay? I like chairs that have sides to them, and I don't know why, they don't really make those anymore, but, like sort of a grandma's, that really helps kids to stay on. So if you can find a chair like that with sides, that will be great, but really just make sure that they're as supported as possible. Number 2, sit at a table. And I know it's hard. I know kids are eating while they're looking at TV or on the iPad or whatever we've been able to do to manage for them to eat. But the key here, so what the research says, is really the concept of children learn through imitation. So they have to see you eat for them to eat. They have to actually imitate. And so I always say, even if it's just one person sitting at the table with the kid, that's fine. And you have to be in front of them so they can see you. And what we do is we try to model good feeding behavior. So we actually say, look, I have the food here, and I'm going to move it to here, and then I'm going to chew it. And we actually open our mouth, and we show them, this is what we do, because it's not instinctive to them. They don't know how to use the muscles of their mouth, okay? The concept of a family meal. So what we do is we serve food in different plates, and if the child is not going to eat it, at least they're exposed to it, because they have to pass the plate to someone else. So they're exposed to the smells, the sight, the color. So expose and pass, okay? So we pass the food around, because the only way someone is going to eat anything is really through exposure. They have to be exposed to what they fear. So working towards having the child sit at a table. And it's very interesting. We did a research study looking at one of the interventions in feeding. It's called the SOS approach. And which is 12 weeks, and it's very set as to how we build up the food repertoire of a child. And we did see positive changes. So a lot of the kids were able to eat 3 more new foods after 12 weeks. But what was a real interesting finding from this research was that what parents valued the most after the 12 weeks was the fact that we were able to bring the child to a table. The fact that they are now having one meal, so you're not cooking for everybody, so you're not making 3 different meals because so-and-so is not going to eat this, and the fact that you're sitting together at a table. So, that just brought the stress down quite a bit. So even if your child is not going to eat, shaping the behavior to bring them to a table is going to be helpful, and it's going to set them up for success for eating, okay? And then, of course, we talk about focusing on the food, not the child. So we try, when we're sitting at the table, we try to talk about, look at, this is a wet food, this is a dry food. You can put it to your mouth. You don't have to eat it, but you can kiss it. So see, we have touch. So we sort of we always say to the child, you don't have to eat it, but it stays on the table. So you can't push it away. It stays on the table. You tolerate it, okay? Some of the things that we do, if your child is not eating, we offer the drinks at the end, right? Because we don't want to fill them up. So you eat first, then you get your water or your milk. If your child is eating too much, right, you offer your drinks at the beginning. So you give them drinks, so then they're not going to eat as much, okay? So think about that. And then, of course, if your child is overeating, you want to try to slow them down. So we use timers to try to, okay, let's chew the food like 20 times and just play that kind of games to teach the child to have some awareness of their hunger. Gradual exposures to new foods. So there are 6 steps to eating. So we start from tolerating all the way up the ladder. So tolerating, just being in the same room as the food, interacting with a fork, so just touching the food, to smelling it, to touching it, to tasting it, to eating. Okay, and within these 6 steps, we actually have 32 that we break it down into. That's how hard, that's until you get to eating. There's 32 steps that we complete, and I think this is key in getting a picky eater to eat, is where it may be that you expose them to the chicken the first time around, but they were not able to tolerate it, so they threw it, right? So next time around, you're just moving up the ladder. So that's success, because maybe you can get up to the smelling, and then eventually the touching. Well, the eating is going to come. But it's continued gradual exposure to new foods and not giving up. Like the research says that it takes 10 times for a child to be exposed to a new food for them to actually to be able to eat it. So this sort of systematic desensitization is where you want to move towards. And this is huge. So I'm so glad that Dr. Foster mentioned the mind-body connection, and there was a slide in her presentation that had the brain and the autonomic nervous system, right, to the gut. And I think this is something that we just don't put enough emphasis on. So how does anxiety affect your eating? Okay, and we know that if you're anxious, you're either not going to eat enough or you're going to eat too much. I'm not sure in which camp you fall into, but we need to, instead of focusing on eat or stop eating, we want to think about how are we going to help these children manage anxiety. And again, anxiety comes with autism. I mean, a conservative estimate is 40% of children with autism have anxiety, but I think it's higher. And so this is huge. So how do we manage anxiety? So to allow the child to function to their best. And I think if you think about yourselves, like, I recently had a stressful situation happen to me, and this never happens because there's always food everywhere where we work, and I'm always eating. But the idea that, I was anxious and I wasn't hungry. And I could see whatever the food was, but I just wasn't hungry. And so it makes me think about, this is what the kids are like. They're in a constant state of what I call coping. So when you're just coping, then that's an expensive state to be in, because, you shut down really quickly. You can't accommodate. You can't think of what you should be doing because you're in a state of anxiety. So as in rehabilitation, what we do is we talk about 2 different approaches to anxiety management. One of them is a bottom-up approach, where you use your body to try to calm you down. So in this approach, we're looking at things that have deep pressure and a heavy work component to them. So we get the kids to, push your hands together, pull them apart before they go to the table, or stomp to the table, or let's push the table down really hard so you get pressure through your body, and that pressure calms you down. It's like going to the gym. You get those, nice feelings or whatever from working out, and I think it's this idea of heavy work settling the body down. So there's many things you can do. I get parents to do a tug of war before they actually get to the table with the child. Deep breathing. So we do things like bubble blowing before we eat. So before we go to the table, because that stimulates deep breathing, right? So again, thinking about slowing down your breathing. And working towards what we call a sensory lifestyle. So if you're able to put sensations into your child or person with autism's life that are calming and regulating to them throughout the day, then chances are you're going to have more success around the feeding, okay? So think about the things that they like. Is it jumping on the trampoline? Is it rocking on a chair? Is it smelling a certain smell? What is it that calms your person down? And then can you put more of that into your life so that then you can have someone who's working at their optimal level when they're eating, okay? So top-down approach is what we call a cognitive approach. So this is what we do to try and get kids to become more aware of the kinds of things they can do to help manage their anxiety. So we use a lot of timers. In 5 minutes, it's dinner time. There's my phone. When the bell goes, you need to come to the table. So we help the children predict what's going to happen. And with increased predictability, anxiety management is better. We use visual schedules. Even if the child knows what's happening and if they can tell you, what's happening at every minute, the fact that they have a visual that they have to follow, it settles the brain. So use visual schedules regardless whether they understand it or not. People say, oh no, but he speaks, he doesn't need the visual. It's not about speaking, it's not about understanding, it's about anxiety management. It's about knowing that something is coming after the other and making things predictable. I'll tell you a little bit about reward charts in a second. Body scan, so the whole idea of maybe talking about, how is your tummy feeling? Do you have butterflies in your stomach? And just getting the child to become more aware of their bodies, because this is big in the children and the young adults that I work with. They really have no idea of what's going on with their bodies. There's a real disconnection. So anything that we can do to try and bridge that gap, it's helpful. Video modeling. Now we have these smartphones where you can videotape your child and when they're eating something, and then you can actually review it with them and talk about what was the smell of the food, what did it look like, how was the experience. So again, increasing awareness. And hunger awareness charts. So this is interesting concept where you can have something like a 1 to 5 scale, where 3 is when you're hungry, 4 is you're super hungry, 5 is I'm starving, and then 1 is I'm not hungry. So the idea is like, where are you on the scale? Like, are you hungry? Are you out of 3? And then you eat. But are you at the 2? Well, do you really need to? If you're overeating, do you really need to be eating right now? Can you wait until you're at the 3? Okay, so using scales to try to increase awareness. And then MCBT, which is Modified Cognitive Behavioral Therapy, and I'll tell you about that in 1 second. And so I love reward charts, and I know they're a lot of work, but they work. And the way I would use this with feeding are things like, if you have a child who's overeating, you would say, okay, look, you get 3 chocolate bars a week. Why don't you choose when you want to eat them? So they have some control as to, I'm going to eat the chocolate bar on a Monday, on a Wednesday, or on a Friday. And then you can say, okay, well, do you want to have it at breakfast, lunch, or dinner? For us, it doesn't matter when they eat. The question is, can you give them some controls, but then they're still expected to eat the nutritional food, but then they have their treats. We use reward charts, for kids who are not eating. So, let's try a new food every week. When do you want to try the new food? Okay, we'll try it on Wednesday. Fine. And then you get the check mark and you work towards a reward. Again, it's using a visual that just makes life a lot easier with a child with ASD. Okay? Calendars, visuals. And this whole idea of cognitive behavioral therapy, so this is there's a lot of research going on in using CBT with kids with autism and young adults, and what they do is they try. This is done by psychologists mainly, but they use a lot more visuals, and again, look, it's all the connections between your thoughts, your behaviors, and your feelings, and how all that goes together. So I think that the biggest message that I have is really let's try to work on how we can get the children more connected to their bodies, more aware of their bodies, and to manage their anxiety, so that then feeding becomes a more successful task. And I really like this program. It's called the Red Light, Green Light, Eat Right program. It's by Dr. Jenna Dolgoff. And what she does, this is for kids who are overeating. So you put this on the fridge, and you have your green, your yellow, your red foods. And so basically, as your child is going towards the refrigerator, then they get to see which foods they can choose from the green side. You know, she says, well, you're allowed 2 red foods a week, so then the child can decide, okay, which ones am I going to have a week? So again, it's a visual way of building awareness of nutritional foods for the children. And she has, it comes in, you know, there's a book, there's a whole package on it, but I do think the idea here, what I like the most is that it's a visual on the fridge, that as soon as the kids go in for it, at least they have to look at it and make some sort of decision. Okay, and number 5, fighting the obesogenic environment. So I was reading the Globe and Mail a couple of weeks ago, and this is one of the charts that they were showing. So I know that consumption of sugary drinks, so like things like Coke and sodas, has gone down significantly. But what they're saying is, I mean, this is from 2004 to 2015, look at the amount of energy drinks that are being consumed. So the increase of 638%. Things like sweetened coffees, so you know, the coffees that we like with the sugar, flavored water, 527%. Drinkable yogurt, which I hate, but you know, it's so hard to find something that the kids can take for lunch for school. So really the idea here is, instead of thinking about, you know, how can we manage the fats in your diet, well, the new bad guy is really sugar. So the idea is, how can we decrease the sugar that that the kids are eating? Because, you know, your whole environment, it's set to make you a sugar addict. And of course, the more you eat sugar, the more cravings you get, the more you're going to eat. So that's just something to think about. And just some resources to give you. So the ATN has Exploring Feeding Behaviors in Autism. I really like the Autism Speaks website. I've done a few articles for them, and they have a column called the Food for Thought column, where parents come in and they ask questions about feeding, and then they have experts around North America answering those questions, and I find them very helpful. So that's a great website to go to. And thank you, and I just wanted to leave you with this quote. These are my 2 kids. And like my husband says, that's the only time I've ever seen them eat broccoli. But no, they eat it more often than that. But anyway, so growth is a process of experimentation, a series of trials and errors, and occasional victories. Okay, with feeding is occasional victories. The failed experiments are as much a part of the process as the experiments that work. Okay, so thank you so much.